Good morning po. I am Dr. Salinas. Ano pong pangalan ninyo?
Marcel.
Sir Marcel, okay lang po ba? Examine po natin yung spine nyo, mga kamay at mga paa.
Okay.
Okay. Let's start with the cervical part. We have to palpate for the lumbar, which is the C7 vertebrae. It is palpable. No nodules or deformities that is palpable. Next is the cervical range of movement. First is flexion. Paabot po ng baba sa dibdib. Okay, extension. Tingala po tayong maigi. And rotation. Tingin po kayo sa kaliwa. Tingin sa kanan. And lateral bending. I-bend nyo po yung ulo sa left. I-bend nyo sa right. Okay, so the patient was able to perform the normal range of motion for the cervical spine. Let's now move on to the fingers. Patingin po ng mga daliri ninyo. So the fingers are, the hands are symmetrical, no deformities noted, no tenderness, no bulging observed. Ganito po ng ganito po. Okay, no negative for fingernail clubbing. Sir, gayahin niyo po ako. For the range of motion, first is the adduction, which is fingers together. Abduction, spread the fingers. Flexion, close fist. Extension, open. Apposition, thumb to each finger. And thumb abduction, thumb to palm. Thumb adduction, thumb to neutral position. So the patient has a normal range of motion with his fingers. Next is the wrist. Patingin po ng there is no deformities, masses, or tenderness upon palpation of the radial and ulnar distal end on the wrist joint. There is scar lesion at the left hand about 4 centimeters. Now, next is the range of motion of the wrist. First is the dorsiflexion, gayahin niyo po ako. Palmar flexion, medial deviation, and lateral deviation. Okay, the range of motion of the wrist is normal. Thank you. Now, let's go with the forearm. Patingin po ng forearm ninyo. Forearms are symmetrical. No tenderness, no muscle and bone deformities, no swelling, and masses. Okay. Now, for the range of motion, first is pronation and supination. So my patient has a normal range of motion of the forearm. Next is the elbows. For the left elbow, this is the olecranon bursa, the olecranon process, the medial epicondyle, and the lateral epicondyle. No nodules, swelling, and tenderness. For the right hand, this is the olecranon bursa, olecranon process, lateral epicondyle, and the medial epicondyle. No nodules, no swelling, tenderness. Now we are going to measure the circumference of the forearm. So the forearm below the below the elbow is 25 centimeters. For the left forearm, it's also 25 centimeters. They are symmetrical. For the upper arm, above the elbow, it's 26 centimeters. For the left upper arm, above the elbow, it's also 26 centimeters. They are both symmetrical. Now for the range of motion versus flexion, pakiganto po yung kamay. Extension, pronation, supination. So my patient's elbow's range of movement is normal. Now, let's move on to the upper arm. The left and right biceps and triceps are symmetrical. No deformities and tenderness observed. There is also no deformity of the humerus. Okay, next is the shoulder. This is the sternum. This is the sternoclavicular joint, acromion, coracoid process, the greater tuberosity of the humerus. Okay, may masakit po. There are no deformities and tenderness noted. No swellings of the fingertips, no tenderness. Next is the range of motion. So, first is flexion. Pakigaya po ako, pataas ng kamay. Ayan. This is the flexion. Extension, abot po sa likuran. And the abduction, umpisa nyo po dito, tapos itaas nyo po yung kamay nyo pa ganyan. And the adduction. Adduction. And then, internal rotation, paabot po ng shoulder blade dito sa likod. Ayan. And then, external rotation. Okay. The range of movement of my patient's shoulder is normal. Now we are going to do the thoracal lumbar spine. Okay lang po ba patanggal ng t-shirt ninyo? Thank you. So my patient's spine is at the midline. My patient's curvature and alignment of his spine is normal. May masakit po ba? Sabihin niyo po pag may masakit, ha? Okay. No tenderness upon palpation and no muscle spasms. Now, next, we're going to ask the patient to stand for the active range of movement. Tayo po kayo. So, first is reflection. Paabot po ng toes ninyo. Okay. Next is extension. Lumiyad po kayo. Okay. Next is lateral bending. Reach nyo po yung right knee. Ayan. And then left. Okay. Spinal rotation. Gawin nyo po to. Okay. My patient has a normal range of movement. Now for the hips, we're going to ask for the patient to lie down and do a lateral decubitus position. Tagilid po kayo, sir. We are going to palpate for the iliac crest and greater trochanter for tenderness. May masakit po ba, sir?
Wala.
Okay, sa kabilang side po. Iliac crest, greater trochanter, may masakit po ba? Okay. So my patient is negative for tenderness. let's go with the range of motion. First is the flexion. So okay. We have flexion of the right leg, left leg. For the extension, tagilid po kayo. Okay, extension of the right leg. Next, other side. Extension of the left leg. Okay, thank you. And for the abduction, sir, pwede po ba ilabas ninyo yung paa ninyo? Okay, balik sa gitna. Yung kaliwa din. Balik sa gitna. Okay, and for the internal rotation and external rotation of the right leg. Internal rotation, external rotation. So my patient range of motion is normal. Now let's proceed with the special tests. First is the evaluation of the patient with back pain. The first test is the straight leg raising test. The patient is on a supine position. Then we're going to raise one leg at a time around 60 to 70 degrees to check for pain in the buttocks to the leg. May masakit po ba? Dito masakit? Wala. Okay. Next. May masakit po? Okay. So my patient is negative for straight leg raising test. Next is the Patrick's test. So what we're going to do is we're going to ask the patient to put his heel on the opposite knee. Pakilagay po yung heel ninyo sa right leg. Yeah, okay. Thank you. Then check for sacroiliac pain in the sacroiliac joint. May masakit po? Okay, yung isa din. May masakit? Okay, so my patient is negative for Patrick's test. Now, we have the Galen-Lenz test. What we have to do is to hyperflex the hip while the opposite leg is dangled to do passive hyperextension of the hip joint. Then we are going to check for sacroiliac pain. May masakit po? May masakit? Okay. There's no pain, so my patient is negative for Galen-Lenz test. Now we are going to evaluate the patient with hip flexion constructure and lumbar lordosis. We have the Thomas test. So while in supine position, we are going to flex the hip and pull the knee as close as possible to his chest. Both legs. Pakikita po yung tugod ninyo sa dibdib nyo. Okay, upon doing this, the other leg is raised, indicating the patient doesn't have hip flexion, contraction, and lumbar lordosis. Next time po. Okay, on this side, the other leg is also raised. Thank you. So next is the knee joint. The patella is palpable. Okay. No deformities, no cysts, and no tenderness. Now, we're going to measure it. Uh, 40 centimeters for the right leg. 40 centimeters on the left leg. They are symmetrical. 5 centimeters below the knee on the right leg. Okay, 35 centimeters on the left leg. So both knees are symmetrical. Then for the range of motion, we have flexion of the right knee, and then extension. Flexion of the left knee, and then extension. We have a normal active range of motion on both knees. Now we move on to the ankle joint. So this is the lateral malleolus. This is the medial malleolus, the calcaneus. May masakit po ba? Okay, no lesions, no swelling, no edema and deformities. For the left ankle, this is the medial malleolus, lateral malleolus, and then the calcaneus. May masakit po? Okay, no swelling, no lesions, no deformities, and no tenderness. Now for the range of movement, first is the dorsiflexion. Okay. And then plantar flexion. Now for eversion, and then eversion. I'm sorry, this is inversion, this is eversion. Okay, for the left ankle, now do dorsiflexion, plantar flexion, inversion, and then eversion. Okay, thank you, and that's the end for the spine and extremities.